Our next guest has more than 30 years of experience, success, and accomplishments in national healthcare policy development, business development, and leadership in both government and the private sector. As TriWest Healthcare Alliance Co-Founder, President and Chief Executive Officer, David McIntyre spends days in and days out ensuring veterans in roughly half the nation have access to high-quality health care when it is unable to be provided by the Department of Veterans Affairs. Based in Phoenix, Arizona, TriWest is one of the 2 third-party administrators actively running the VA Choice Program. TriWest serves VA across 28 states in the Midwest and along the West Coast. Ladies and gentlemen, please give a warm welcome to TriWest Healthcare Alliance President and CEO, David McIntyre.
Commander-in-Chief Harmon, thank you for that warm introduction. I know many of you have put your phones away. As I start, I'd like you to ask to take them out. Don't turn on the ringer, but turn it on. And when I get to the end of my remarks, you'll understand why. We're privileged to support the VA, as Commander-Chief Harmon said, in delivering health care needs at the side of VA in 21 states, including here in Missouri and in the state of Kansas. Well, the early days of responding to the crisis in access that was first disclosed in our hometown of Phoenix, Arizona, were challenging for all concerned. I'm pleased to report that the provider network that we've constructed along with our nonprofit owners, the Blue Cross Blue Shield plans and universities that own us across 21 states, has now delivered 10 million appointments in support of VA. Everything from chiropractic services to brain surgery and everything in between. It really depends on what the gap is in a VA facility or where a veteran lives as to what services we're called on to provide. By the way, we know that providers across this country have not been getting paid on time. That was true long before we arrived. I'm pleased to tell you, though, that in the area that we deliver services, the providers are being paid to an accuracy rate of 98% within 30 days for the services that they're providing. You know, there's been a lot of debate about privatization, non-privatization of the VA. I'm here to tell you as a fellow citizen, not a former citizen, I hope, but as a fellow citizen, it's not about the private sector replacing the VA. It's about making sure that when a veteran has to wait for a long time or has to drive for a very long distance, that they have options. And there are great Americans in this country that are providers that say, I'll take a couple. And that's what this is all about. It's about providing the right elasticity for VA to be able to deliver on its commitment to our nation's heroes. So I'd like to say 3 things today. First, thanks to all of you who have worn or currently wear the uniform of the United States for your service. Know that those of us privileged to work in support of your health care needs, whether we be in the private sector or whether we be in the VA, will not rest until we believe we've delivered on our responsibility to reset an enterprise that's critical to delivering on this nation's commitment. And ladies and gentlemen, we still have work to do. We're focused, we're doing our job, but we got a lot left to do. Second, I'd like to thank VFW for setting the pace for responsible engagement in keeping all of us focused on what matters for this nation's veterans. Were it not for your effective leadership, the future would not look as bright as it does with regard to the future of VA. And as we look forward to continue to be pushed by all of you to ensure that we're rising to the occasion to achieve the art of the possible for current and future veterans, I'd just like to tell you that some of us will remain deeply focused in that fight. Third, and the reason why I asked you to take out your cell phone, is I'd like to bring to your attention a program that we're privileged to support on behalf of the federal government. It makes available services to veterans, their families, and those that currently serve. It's a peer-to-peer call and outreach center called Be There. That's a great term, right? Being there for your buddy, being there for a friend, being there for a fellow citizen. It's staffed by combat veterans and family members that are available 24/7 to assist our nation's heroes if they're struggling. It's part of the fabric of the fight to make sure that we reduce the number of 20 a day, 22 a day that ought to be reduced down to 0 when we accomplish our job. The initial concept was actually conceived of by the former Commandant of the Marine Corps, Jim Amos. He lost a staffer to suicide at 3 in the morning. He reached out every day at 3 in the morning for a week and called all the lifelines that should be available to that individual. He didn't know why he was struggling. He didn't even know he was struggling. But he also found that he couldn't find a lifeline at 3 in the morning that he was happy with. He picked up the phone. He called me. I was landing in D.C., and he said, "I need to see you in the morning." And it was a very snowy day in Washington. I said, "What have I done?" I served at the side of the Defense Department in TRICARE for a long time, from the start of TRICARE through its maturation. Then we needed to be moving on to the next fight at the side of government to get things right. And Jim Amos said, "I need to see you in the morning. I'll tell you when you get here." And I arrived, and there were 4 of us in that office. It was a snowy day. There weren't many in the Pentagon. And we spent 6 hours in his office. And out of that came this program. And it was really designed to make sure that when you called at 3 in the morning, or whenever you might call, or text, or Skype, or whatever you might do to reach someone, that someone was going to be on the other line that was relevant, that was immediately available, that could take your arm and make sure you didn't jump from that ledge. And then the Marine Corps made a commitment to address the issue in its old culture by making it okay to reach out for help and okay to say, "Hey, I'm struggling," led by then General Amos. So if you could, I'd like you to take out your phone, and I'd like you to write in the word "Be There," B-E-T-H-E-R-E. We don't do this program as a company, we do it as fellow citizens. We do it for the government. This is not a marketing campaign. At the end of the day, if you have a friend, or you have a colleague, or you know someone that's struggling, or more importantly, you're at a bar, and someone's articulating some concern because they've had a drink or two, dial the phone number and walk away, handing them your phone. The phone number is 844-357-PEER, which is 7337. I know it's up on the screen, but for those of you in the back, let me repeat the number. 844-357-7337. This has been up for 9 years, serving the Marine Corps. Now it serves all services. We've never lost a Marine. That's because of the commitment and the faithfulness of a general who was leading from the front. Thank you for your service. Thank you for your attention. Thanks for what you do. Thanks for the great organization that you're a part of. And I hope you have a great convention. Have a good day.